Hello everyone, welcome to Pediatrics and Neonatology. This video is about teething in babies. Teething in babies can be a time of great frustration for parents. So in this video, I will discuss order of tooth eruption in infants, most common teething symptoms, how to soothe sore gums, treatment to avoid, and how to care for babies' new teeth. First, the order of tooth eruption in infants. When and how teeth come in can be different for every baby, and it may be based on family history. But most of the time, the lower front two teeth come in first between the 6 and 10 months. This is followed by the opposite top two teeth and the two on either side of those between 8 and 13 months. Next come the two on either side of the bottom front teeth. Then the first molar appear between 10 and 16 months. Now the teeth in front of the first molars are the next, and the back molars are the last one to come in. And in all, 20 baby teeth will eventually be in place, usually by the age 3. Next, I will discuss commonly reported teething symptoms in babies. First is irritability. This is caused by the discomfort of the teeth erupting through the gums. Often the first teeth and the molars are the most uncomfortable. Other symptoms include disrupted sleep, loss of appetite, swelling or inflammation of the gums, drooling, rash around the mouth. Excessive drooling can cause a rash around the mouth, cheeks, chin and neck area due to the extra bacteria on the skin from the saliva. Then there may be increased biting and gnawing. The counter pressure from biting on practically anything can elevate the pressure from under the gums. Other important symptoms of teething in babies include bringing their hands to their mouth, gum rubbing, cheek rubbing and ear pulling. This is caused by the pain in the gums, which can travel to the cheek and ear, especially when the molars are erupting. Infants will rub those areas. Next is coughing. The extra saliva produced during the teething can cause an occasional cough or gag. And there may be mild temperature ranging from 98 to 100 degrees. It can be caused by an infant putting their unclean hands and fingers in their mouth. Next, I will discuss how to soothe sore gum in babies. Number 1. Keep it cool. A cold pacifier, spoon, clean wet washcloth or a solid refrigerated teething toy or a ring can be soothing on baby's gum. Frozen teething toys are too cold and they may hurt baby's mouth, so avoid them. Make sure to clean teething toys, washcloth and other items after the baby uses them. And try offering a hard, unsweetened teething cracker. Now, if a baby is older than 6 to 9 months, then cool water from a sippy cup can be offered. Also, massage your baby's gum by gently rubbing them with clean finger. If the teeth haven't come in yet, then you can let your baby gnaw on your finger. Now, if you are nursing your baby, then try dipping your fingers in cool water and massage their gums before each feeding. That may keep them from biting your nipple while nursing. Now next is how to help your infant's irritability. For this, cuddle more. The extra time spent with your baby can alleviate their pain by providing feelings of being comforted and reassured. Next, how to help your infant's drooling. For this, try to keep the area as clean and as dry as possible by periodically wiping the area. Applying a simple barrier cream can help with the dry, chapped and sore skin. Next, how to help your infant's coughing. Now, if your infant's cough continues or is accompanied by high fever and cold or flu symptoms, then contact your infant's pediatrician. Because the high fever with cold and flu symptoms is not related to teething, but is actually a sign that your infant is sick. Next is how to help your infant's low-grade fever. For this, use an age-appropriate pain medication and please consult your infant's pediatrician and the medication label for correct dosage. However, if the fever reaches above 101 degrees or continues, then contact your infant's pediatrician because it may not be the teething but a more serious illness. You also should call the doctor if your baby's gums are bleeding or you see any pus or swelling of their face. Next is how to help your infant's cheek rubbing and ear pulling. For this, try rubbing and massaging the gums with a clean finger for 1 to 2 minutes to help with the discomfort. Keep in mind that ear pulling or rubbing can also be a sign of an ear infection. So please contact your infant's doctor if the symptoms continues or is accompanied with a high fever. Now some words about teething and diarrhea. Many people believe that increased saliva produced during teething can cause stool to become slightly loose. Keep in mind that diarrhea can be a sign of more serious infection. So contact your infant's pediatrician if diarrhea is accompanied by vomiting or a high fever, or the stools become watery because your infant could be at risk for dehydration. Now I will discuss treatment to avoid during teething in babies. To keep your baby safe, avoid using over-the-counter remedies including homeopathic teething tablets. Lab analysis of some homeopathic remedies have shown that they contain higher amounts of ingredient belladonna. This can cause seizures and difficulty breathing in babies. Next is teething medicines or gels that you rub on your baby's gum to stop the pain of teething. These may not help. These contain benzocaine or lidocaine, which are not approved for children less than 2 years. These medicines quickly washes away in the mouth and may numb the back of the baby's throat and make it hard for him to swallow. This may be fatal too. Now other things to avoid during teething is teething necklaces, bracelets or anklets. These items pose a risk of choking, strangulation, mouth injury and infection. Now other treatments to avoid is products filled with liquid that can tear and spill or are made of breakable material like plastic that can possibly lead to choking. Now I will discuss how to care for baby's new teeth. Good oral hygiene is important even before your baby has teeth. Run a soft, clean cloth over your baby's gum twice a day, after the morning feeding and before bed. The cleansing can keep food debris and bacteria from building up in your baby's mouth. Now, when your baby's first teeth appear, use a small, soft bristle toothbrush to clean his or her teeth twice a day. And until your child learns to spit at about age 3 years, use a smear of fluoride toothpaste no bigger than size of a grain of a rice. And switch to a pea-sized dollop as your child approaches 2 to 3 years of age. Now it is also time to think about regular dental checkups. The American Dental Association and the American Academy of Pediatric Dentistry recommend scheduling a child's first dental visit at or near his or her first birthday. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.